For more on this, we're joined by Dr. Mads Gilbert in Tromso, Norway. He's a professor of emergency medicine at the University of Tromso, who's been training doctors in Gaza for the past 20 years. Welcome back to the program, Doctor. You and I have spoken on a number of occasions throughout Israel's 2-year war on Gaza. You've expressed how frustrated and angry you've been that Israel's attack has persisted, killing now more than 67,000 Palestinians. Can I get your initial reaction to news of this latest ceasefire deal?
Thank you. It's very mixed. My emotions are extremely mixed on this day. First of all, I want to reiterate the numbers that you gave, with more than 20,000 children killed. And the number you gave with 67,000 altogether killed is probably, according to recent research, it's 41% underestimating the real death toll. So we're talking about close to 80,000 or more killed. And we have to commemorate these people, because they're 81% to 90% civilians. And the whole civilian society in Gaza has been shredded and completely destroyed, including my field of profession, the medical care. So that's one of the feelings. The other feeling is, of course, that I am very happy on behalf of the people of Gaza that they will have quiet skies, that the bombing and the mass murdering will stop, at least temporarily, and that the fences will open for food, water, medicine, and supplies to come in. Long time overdue. But I'm fearful, because we've seen so many times before how the Israeli army, how the Israeli authorities, and not at least Netanyahu, are breaking all treaties and all agreements. Look at what happened in February, when there was a peace treaty, there was exchange of prisoners, and they broke it simply. So I don't trust Israelis a minute, and I'm very fearful that once the prisoners in Gaza are released, which is also overtime, of course, the bombing will be picked up again, because Netanyahu and Ben Gvir and Smotrich, they have not the goal of finding a peaceful, lasting, just solution for the Palestinian people. They have a goal of expanding Israel on behalf or on the cost of the Palestinian people. So mixed feelings today.
Yes, and those concerns are being shared by many analysts around the world. But in the meantime, we do have this first phase of the ceasefire deal that's expected to be carried out after the deal is ratified in Israel. A part of the deal is the delivery of desperately needed aid into Gaza. We know the deal stipulates that some 400 trucks full of aid are going to be allowed into the enclave each day. We also know that that really is just a drop of what's needed to address the humanitarian crisis that's taken hold of the entire enclave. Tell us what you're hearing on the ground there. What do Palestinians need in terms of aid?
Well, they need everything. And as you rightly say, these numbers are far too low. Don't forget that before 7th of October, the daily need to support the life in Gaza was 400 truckloads per day of, utensils, food, whatever is needed for daily life. So the number 400 is far too low, but it's better than nothing. What they need in Gaza mostly is food. It is water, clean water. It is hygiene with soap, showers, provisional toilets. They need shelter. They need tents. Many of my contacts in Gaza cannot afford to buy a tent after they have been forcefully displaced again. The price of a tent, a cheap tent in Gaza today, is actually $900. It's extremely expensive. So shelter, food, water, hygiene products, milk powder for the newborn. There are 120 children born every day in Gaza. And of course, for the medical field, my colleagues are desperately awaiting medicine, medical equipment like instruments, and power to the hospital so they can run the ICU equipment, and reliable supplies of food and water. And also, importantly, the official economy in Gaza is in ruins. So many of my colleagues, doctors, nurses, paramedics, They have not been paid salaries. So there is a desperate financial need in Gaza to pay the public servants their salaries, because they are, as the rest of the population, displaced, they are poor, and they need to feed their families. So there is a multitude of needs, but most of all, it is peace or ceasefire. It is food, water, security, shelter, and then the needed supplies for the medical sphere. And when I say that 400 trucks per day is not enough, it's not only because of the supply of nutrition, food, water, and medicine. It is also because they're going to rebuild, and the rebuilding process must start very quickly in order to get schools, hospitals, primary healthcare clinics, roads up and running again. And I'd also like to comment on all these well-willing NGOs who are portraying the civilian society in Gaza as in complete chaos. No, it's not. The Palestinians have been very careful to keep organized. Today, this morning, the ambulance services issued very detailed instructions to the population where they could find ambulances, where they should go, that they should not move until they are given orders to move by the Palestinian authorities. And it's a society that has been remarkably well organized, despite this horrific genocide and the complete destruction of the society. So my praise, my admiration, and my Mubarak, my congratulation goes out to all the Palestinians, and in particular those who have been serving in the public sector, like healthcare workers, teachers, and community workers.
Doctor, we also know that in August of this year, a famine was officially declared in large parts of Gaza. You had warned the international community in the lead up to that declaration that a famine in Gaza was looming. Do you expect that situation to improve now that we do have this first phase of a ceasefire deal?
Again, I think the key word here is lasting. If the food supply to Gaza will be lasting, we may ameliorate, we may be able to prevent an expansion of the hunger disaster. And let me remind your viewers, this hunger disaster is 100% premeditated and man-made by the state of Israel. There is no doubt. But if this is only a temporary influx of food, it might be worse than nothing. Because when you are going to refeed the 640,000 people who are now in the ICP phase 5, which is starvation, you need to do that in a very controlled way with very well-planned nutrition elements. You need to monitor the electrolytes, the salt balance of the body. And of course, the immediate urge for a person who has been starving is to eat and eat and eat. And if you overeat, if you feed children, and in particular newborn and infants too quickly, they will have metabolic diseases. They can even die from that. So it has to be a lasting, it has to be a reliable, and it has to be a well-composed influx of nutrition, food, water, and most of all, the healthcare system must immediately be protected, rebuilt, and be able to start up and continue their medical work. Don't forget that it's only 1/3 of the hospitals in Gaza that are working heroically with Palestinian healthcare workers, and we need to expand on that. The Palestinian healthcare and the healthcare minister, Dr. Youssef Abrish, they have plans to rebuild, restore, and repair those hospitals that have been destroyed. So all of this needs the attention of the international community to force Israel to not only allow, but to facilitate an unlimited influx under Palestinian leadership and UN leadership of building material, of equipment, food, water, and medical supplies. But most of all, for the children, for the women, for the elders, they need a guarantee from the international society that this cynical, sadistic military army of Israel will not be allowed to let loose again. They must be stopped, and the root problem must be solved, and that is a lasting peace with a just solution for the Palestinian people, which means an end to the occupation of Palestine and an end to the Israeli Zionist settler project of annexing the West Bank. That is the only long-term medical solution.
Okay, Dr. Mads Gilbert, we'll have to leave it there. Thank you very much again for joining us on the program.